Did you know about 70% of people around the world will experience at least one traumatic event in their lifetime? Trauma is a threatening event or series of events that is emotionally or physically harmful, which may include violence, abuse, neglect, natural disasters, or losing a loved one due to a traumatic event. Trauma can be experienced directly or indirectly by a person, such as directly by working as a police officer, or indirectly, such as working as a therapist and hearing about the traumatic experiences of others. Major factors that contribute to an individual's response to trauma include culture, one's values, beliefs, and a way of seeing the world, social support system, if they have people in their lives who are truly supportive or not, and one's developmental stage, or where they are in their lifespan, for example, being a teenager or an adult. Some common reactions to trauma can include feelings of fear, anxiety, humiliation, guilt, shame, or betrayal. People may ask questions such as, "Why me?" How other people respond to a person's trauma can also impact how a person experiences their trauma. For example, some people may not feel heard or understood by others, or others may downplay the importance, severity, and seriousness of their experience. This can be very hurtful and invalidating. A person can also develop more severe signs and symptoms of a trauma-related disorder, such as post-traumatic stress disorder or acute stress disorder. Some signs of a trauma-related disorder can include frequently feeling nervous, physical symptoms like stomach upset, upsetting thoughts, hypervigilance, which is constantly feeling on edge, and if one is in danger, so one needs to be constantly on alert for threats. These symptoms can worsen with thoughts and reminders of the traumatic event. Therefore, people may try to avoid anything that reminds them of the event, but those symptoms can also be triggered for no external reason at all. Trauma in childhood can have long-lasting effects. In the CDC Kaiser ACE study, early childhood trauma showed a long-term and a negative impact on physical health and the likelihood of developing mental health and substance use disorders, and at a higher risk of suicide. This study also showed that trauma can impact future job and education performance. Some specific factors that can help with trauma recovery include social support that focuses on forming strong emotional bonds and a sense of belonging and connectedness to others, therapy and other specialized treatment services that focus on trauma-related disorders, trauma-informed organizations, for example, schools and workplaces, ensuring access to basic needs and resources such as food, education, healthcare, and housing. If you or a loved one may be experiencing symptoms of trauma-related disorder, treatment can help. Please contact a licensed behavioral health provider or your primary care doctor to learn more about treatment options. If you're a mental or behavioral health provider seeking information on evidence-based treatment, check out our multimedia solution for continuing education and shareable patient resources at psychhub.com.